Hello everyone. Today's video is about how young people, people less than 40 years of age are getting affected with various neck and back related disorders due to working from home in this pandemic times. I'm Dr. Sidharth. I'm consultant orthopedic surgeon. Let's go ahead and begin the video. So the first critical thing which I want to emphasize is the dramatic change in the working patterns that COVID has brought. So before young people used to go out to their offices, they used to work from their desks and chairs and nice ergonomic spaces. But now, because of COVID-19, there is a dramatic shift in the workstations, practically from a nice office space to sometimes a sofa or a couch, sometimes from the bed as well. So, which is very bad for your joints. If you work in a bad postures, like hunching your back too much or flexing your neck too much to view the monitor screen or the laptop, you tend to overload your cervical vertebrae, your neck muscles. There develops a lot of tension the back of your neck, and that's why you get a lot of fatigue and neck and back related disorders if you relentlessly work in that fashion for more than a few days or weeks. The other important aspect which I want to emphasize is relative immobility. Patients who've come to me with neck and back related disorders tell that the only time they move around is after they finish their work towards the end of the day. Till then they are stuck more or less to the chair. They don't move much. They do any forms of exercise while working. And I've also heard some of my patients tell me that the only light they get while working from home is the light from the laptop. How sad is that, right? So lack of sun exposure, as you know, will decrease the vitamin D levels in the body, and one tends to have a lot of bone and joint related issues with vitamin D pandemic, which is the next, supposedly the next pandemic after the COVID-19 pandemic. So how can one address these neck and back related concerns is number one, get better ergonomics, right? If you're sitting at one place for more than 10 hours a day and working, try and invest and buy a good nice chair and desk. Create a proper viewing angle so that you're not flexing your neck too much, not hunching your back too much. And so if this is the neutral position of your neck, try and have it about 5 or 10 degrees of extension or flexion. This is your viewing window. So make this window 5 or 10 degrees from your neutral as your viewing window of your laptop or a monitor. That way your muscles are not loaded so much by the end of the day. They feel supple and nimble, and you tend to have less bone and joint related issues with this better ergonomics. The other thing which I want to emphasize the young people who are working from home is that try and have a microbreak. So what is a microbreak? Microbreak could anywhere between 45 seconds to 1 minute every 40-45 minutes. Try and get up, do some semi squats or squats, about 15 repetitions, 20 repetitions. Do some simple wall push-ups. You don't have to have fancy gym equipment to do these exercises. You can do them at home. It improves your blood circulation significantly. That way your blood flow to the brain also increases significantly. You will not tend to get irritated or stressed with the projects that are coming up and all. So this will help improving the blood circulation in the body. It will make you feel flexible. Try and have these micro breaks and inculcate them in your regular routine lifestyle. So having understood the causes of neck and back pain and what you could possibly do, the other thing which I want to emphasize is have 1/3, 2/3 division. If you're working for, let's say, 10 hours, work 6 or 7 hours in a sitting position, in a nice chair and desk. Work for 1 or 2 hours in a standing desk. Standing helps burn more calories, number one. Number two is standing gives you more symmetry to your muscles and to your joints, and the body is much more conditioned to burn some calories. And while working in the standing position, you tend to avoid a lot of neck and back related loading problems. So I would urge everyone to, if you're working for, let's say, 10 hours, work 6 hours maybe from the chair and desk, but 1 or 2 hours standing. Take an intermittent 20-30 minutes of standing work done, get a nice standing desk, or create such a setup at your home where you can stand and work also, besides sitting and working. I hope I've helped people who are young to address neck and back related disorders in this video, and I wish I could have I'll be happy to know if I'm of any help to people and my patients who are suffering from these issues and bad economics with working from home. I urge everyone to like this video, share if you've liked it, and subscribe to the channel.